As the monsoon rains refresh India, painting the landscape in vibrant greens and bringing relief from the scorching summer heat, they also set the stage for a hidden danger that often goes unnoticed. Along with the joy and beauty of the rainy season comes a surge in tropical fevers, illnesses that thrive in our warm, humid climate and can affect anyone regardless of age or background. These fevers, often spread by mosquitoes, are a major health challenge affecting millions and straining our healthcare system. Outbreaks disrupt daily life, cause economic hardship, and impact productivity nationwide. Families worry for their loved ones, and communities feel the pressure as hospitals fill up and resources are stretched thin. Basti Trasku steeped. The tropical climate and monsoon rains create perfect breeding grounds for mosquitoes, especially in stagnant water. Even small collections of water, like those in flower pots, discarded tires, or open containers, can become hotspots for mosquito breeding, increasing the risk of diseases like dengue, malaria, and chikungunya. But these fevers aren't inevitable. With the right precautions and community effort, we can significantly reduce the risk of falling ill. With knowledge and action, we can protect ourselves and our communities. Simple steps like keeping our surroundings clean, using mosquito nets, and spreading awareness can go a long way in preventing outbreaks. Understanding how these diseases spread is the first step to prevention. When we know the risks and how to address them, we empower ourselves and those around us to stay healthy. Small changes in our daily routines, like covering water containers, cleaning up our neighborhoods, and using protective measures, can make a big difference in keeping tropical fevers at bay. The fight against tropical fevers starts with awareness, right here, right now. By working together and staying informed, we can build a healthier, safer future for everyone in our communities. India faces several common tropical fevers, each with unique risks and challenges. These illnesses are especially prevalent during the monsoon and post-monsoon seasons, when conditions favor the spread of disease. Understanding these fevers is crucial for early detection and effective treatment, which can save lives and prevent complications. Dengue, spread by Aedes mosquitoes, causes high fever, severe joint and muscle pain, and sometimes a rash. In severe cases, it can lead to bleeding, organ failure, and can be life-threatening if untreated. Early medical attention and supportive care are vital for recovery. Malaria, transmitted by Anopheles mosquitoes, brings cyclical chills, fever, and sweating. If not treated promptly, malaria can cause anemia, organ damage, and even death. Quick diagnosis and proper medication are essential to prevent severe complications. Chikungunya, also spread by Aedes mosquitoes, is known for intense, long-lasting joint pain that can persist for weeks or even months. Other symptoms include headache, fatigue, and rash, making daily activities difficult for those affected. Typhoid fever, caused by bacteria in contaminated food and water, is a risk where sanitation is poor. Symptoms include prolonged fever, abdominal pain, and weakness. Safe drinking water, good hygiene, and vaccination are important preventive measures. Leptospirosis spreads through water contaminated by animal urine, especially during floods. It can cause high fever, muscle aches, and in severe cases, liver or kidney damage. Avoiding contact with floodwater and using protective gear can help reduce risk. Each fever has its own cause and mode of transmission, highlighting the need for targeted prevention. Public awareness, timely medical care, and community action are key to controlling these diseases. Recognizing these threats and taking preventive steps is key to staying safe during the monsoon. Simple actions like using mosquito nets, drinking clean water, and maintaining hygiene can make a big difference in protecting your health. Early detection of tropical fevers can save lives, especially in regions where these illnesses are common. Recognizing the warning signs is the first step to getting the right treatment and preventing complications. Many tropical fevers share similar symptoms, making it easy to overlook the seriousness of the illness. Most begin with a sudden high fever, headache, and body aches, symptoms easily mistaken for the flu or a common viral infection. However, if these symptoms persist or worsen, it's important not to ignore them. Dengue often causes severe muscle and joint pain, sometimes with a red rash that appears a few days after the fever starts. The pain can be so intense that dengue is sometimes called breakbone fever. Chikungunya's hallmark is intense, persistent joint pain, which can last for weeks or even months, making daily activities difficult for many patients. Malaria may show a cycle of chills, fever, and sweating that repeats every few days. These episodes can be accompanied by headaches, fatigue, and sometimes nausea. Typhoid develops gradually with stomach pain, digestive issues, and sometimes a slow, steady rise in fever. Loss of appetite and weakness are also common. Watch for danger signs: severe abdominal pain, persistent vomiting, bleeding, or difficulty breathing. These symptoms can signal a serious complication, so seek medical help immediately if they appear. Confusion or loss of consciousness in malaria is a medical emergency and requires urgent attention, as it may indicate the infection is affecting the brain. When in doubt, consult a doctor. Timely care is crucial. Early intervention can make all the difference in recovery and help prevent life-threatening complications. Diagnosing tropical fevers starts with a doctor's assessment of your symptoms and recent activities. Blood tests are essential to confirm the specific illness: dengue, malaria, typhoid, or leptospirosis. For dengue, tests detect the virus or antibodies. For malaria, a blood smear or rapid test identifies the parasite. Typhoid is confirmed by blood culture, while leptospirosis relies on antibody tests. Accurate diagnosis ensures the right treatment and prevents complications. Always follow your doctor's advice and complete any recommended tests. Prevention is our best defense against tropical fevers. Eliminate mosquito breeding sites by emptying stagnant water from containers, plant pots, and coolers. Cover water storage tanks tightly, wear long sleeves and pants, and use mosquito repellents, especially during peak biting times. Sleep under insecticide-treated bed nets in malaria-prone areas. Use window and door screens to keep mosquitoes out. For typhoid, drink only boiled or filtered water and eat well-cooked food. Simple, consistent actions at home can dramatically reduce your risk. Prevention starts with you and your family. Make prevention a daily habit. Dispose of waste properly to avoid creating mosquito breeding spots. Wash hands before handling food and avoid raw foods from street vendors during the monsoon. Regularly empty water from plant trays and ornamental plants. In rural areas, cover wells and keep water channels flowing. Organize community cleanup drives to remove garbage and stagnant water. Work with local authorities for regular fogging and drain maintenance. Community action multiplies the impact of individual efforts. Together we can build a safer, healthier environment. Knowledge is our strongest weapon against tropical fevers. Awareness empowers people to take preventive steps and seek timely care. Government campaigns, health workers, and schools all play vital roles in spreading information. Community participation, like weekly dry days and using bed nets, has proven to reduce disease cases. Every small action, from covering a water tank to clearing a drain, protects the whole community. By staying informed and vigilant, we turn fear into resilience. The fight against tropical fevers is ongoing, but together we can win. and Aware India is a healthier, stronger India, ready for every monsoon.